Welcome back to Morning at NTV. I do have Dr. Paul Nyende, a psychologist from Makerere University, with whom we are going to be having a banter largely centering around anti-SOP adherence. Why are so few people adhering to the standard operating procedures, even though we know that the coronavirus pandemic is still rearing its very ugly head, with 114 million cases registered on the global scene? You have 2.5 million people who have succumbed to the COVID-19 disease. You have 400,000 people, a quarter of a million, who have died within the United States. And then you still have people who are saying, no, COVID-19 disease is a hoax. I shall not wear a face mask. I shall not social distance, and so forth. You have situations whereby you go to a very hot concentration where there are more than 20 people. You're the only one putting on a face mask, and they'll look at you like you're from Mars. Why? We are dealing with a pandemic. Well, maybe Dr. Paul Nyende might be having a few answers. He's a psychologist from Makerere University, and he joins me right now. Very good morning, sir.
Good morning to you.
All right, first things first, why are we seeing this laxity, this anti-SOP adherence coming in from members of the community?
I would say that generally society develops a sense of fatigue, alertness fatigue, basically because fear is what drives and prompts behavior change. So fear messages have been passed on for quite a long time now, but as we are aware, research shows that fear does not maintain its peak levels. Time comes and the fear subsides, and it is the main driving force behind prompting behavior change. So at some point people begin to feel confident, and also because the threat is not visible as a virus. Some have not had experiences with somebody passing on, so then they begin to think it's a hoax, or they just simply develop a sense of courage and just the fatigue.
Do you think talk of a vaccine also actually contributed to the laxity that we are seeing right now? People thinking, well, of course, we are getting some 18 million AstraZeneca COVID-19 jabs. Why should I be wearing a face mask anymore? Why should I sanitize? Why should I social distance? Yep. COVID-19 numbers are reducing. COVID-19 deaths are reducing. Nambola is close to COVID-19 patients. You look at all those factors. Do you think all that put together is the reason why individuals are now lax to actually adhere to the SOPs?
Correct. I think the development of a vaccine brings about hope, but also sometimes people may step beyond the line and feel that the threat is done. So essentially it increases someone's confidence, and therefore they don't see it necessary to maintain the SOPs because they feel that we have come to the solution. So that's the paradoxical effect it has, even though we haven't yet received it personally.
Do you think this question is precipitated by COVID-19 fatigue, and how does one solve a problem like COVID-19 fatigue? That question of why should we adhere to COVID-19 guidelines when Nambola is closed down, when numbers are reducing, when COVID-19 deaths are reducing. So such questions, are they precipitated by COVID-19 fatigue? And if so, how does one solve such a problem?
Yes, true. Such questions are precipitated by the fatigue. But also what we need to know is that pandemics and epidemics often hit in waves. So much as we think that we are okay, a second wave may strike. So we just don't need to put our guards down. We need to know that it is essential to maintain the SOPs. We need to continue with the messages, giving the population updates and also the global picture, reiterating the position that we need to be safe and that a wave can also strike a second time.
All right, Dr. Paul Nyende, we see a similar problem with HIV and AIDS infections. It seems like people are willing to take their chances at the infections. What do you say to them?
I think the dynamics is quite the same. I think reaching where we have reached in HIV, there was a lot of sensitization. There was a lot of resistance. Human beings have an inbuilt resistance mechanism. We just don't want to be told as adults what to do and what not to do. We like to reclaim our freedom and our lifestyle, and epidemics take away that, and people tend to fight back at some point. Yeah.
What about those individuals who go out in public? You know, you're the only one wearing a face mask, you're looking out of place. What do you say to them?
I think I'm one of those. I put on the face mask everywhere I go, and
Indeed.
Sometimes I get into a group of people and they all look at you and I say, don't mind. let it pass.
Yes, Lugezi.
Yeah, that's my safety, full stop. I think it's better to look at it that way. Do not mind what others say or what others do. Just wear your mask and be safe.
And that's where we are going to be interrogating the missing link. Do you think government dropped the ball when they did refuse to constitute a team of people in the non-sciences, people like yourself, a psychologist, Mr. Paul Nyende, people who deal in behavioral change? Do you think government, as it is, dropped the ball thinking people in the arts were not so important than people in the sciences?
I think we in the behavioral sciences are very relevant in the fight against COVID, HIV and all other issues because we tend to understand human behaviors and the dynamics of groups. Therefore, we could make a great contribution in redesigning programs like messages. Now we need to readjust the messages so that we can maintain the focus and keep people safe. Yeah.
And of course, we in the Daily Monitor today, if you read through, you'll see a story, a police constable shooting to death a senior 2 student who was actually at a funeral. Such situations where heavy-handedness is used to enforce standard operating procedures. Let's talk about a more amicable way through which we can actually enforce these guidelines without people actually losing their lives.
Yeah, I think that is really at the extreme. We don't have to kill somebody in order to maintain the SOPs. We need to continue using a persuasive approach and you know, persuading people and showing them the necessities with regards to the SOPs and how they would protect themselves from COVID-19 other than you being heavy-handed.
Paul Nyende, when you say persuasive approach, what exactly do you mean?
It's more like a counseling approach. It is about, it's a cognitive approach, talking to people and analyzing consequences so that they may begin to internalize the consequences, but also triggering the fear messages so that the person begins to feel anxiety, and this anxiety will motivate and propel a change in behavior.
Well, of course, sensitization of masses, like you say, should have been the ideal way for government to go, but then we didn't see that taking center stage. Why do you think that was the case? Why was government adamant to expedite a mass sensitization campaign so that people adhere to SOPs? Because it seems like it was more costly to use force. People lost their lives during the COVID-19 pandemic and still do.
But I think quite a lot has been done in sensitization. What we need to say is I think they need to do a lot more. They need to reach out more. The messages need to continue coming out through the media and face-to-face so that we can internalize these messages.
Well, we do have people who are saying schools should have reopened as soon as yesterday. We are not talking about the partial reopening. Today we are having senior P6, senior 3 and senior 5. But then you have individuals who are saying, no. All students should have gone back to school as soon as yesterday. Bars should have been reopened as soon as yesterday. Simply because they look at the numbers, there's a dwindling number of infections, especially in the deaths and the number of infections we've registered on the in the country as a whole. So what do you say to such a cluster of people?
Well, my personal feeling is that we need to open up in a staggered fashion rather than...
Continue the staggered phase.
Yeah, rather than a full-blown opening up, because we are not yet very certain. It's still a little difficult to tell where we stand. As you know, we don't have very good statistics here, and we may have an explosion of infection at some point, but the staggered approach will help us get a sense of where we stand, and we can continue to open up and unfold slowly. Otherwise, if we do a full-blown open up, you never know, we might be scrumming back into our houses, homes for a personal lockdown.
I can see the same viewer shaking his head, watching this show and saying, I'm not convinced. Saying, no, schools should have been reopened. There are a few cases, bars should have been reopened. Well, it seems like people are actually adamant to actually adhere to these SOPs.
Yes, people would like to reclaim their lifestyle. Definitely, this has put a lot of strain on our social interactions, on our lifestyle, and the threat not being very visible or direct involvement with a person who has COVID-19, you may feel that it is a little far-fetched. It is one of those gimmicks to make money for officials, and quite a lot of rumors have been going around, and that can also trigger anxiety and resistance in the public.
So the viewer is watching and is asking, is there a cure for COVID-19 fatigue?
Yes, of course, we need to continue talking to people.
Yep.
We need to redesign the messages, to reiterate the necessities of use of the procedures so that we can continue to live safely.
Of course, yes, let's get into the very, very hot conversation, Mr. Paul Nyende, the issue of poverty.
Yeah.
Yes, the issue of poverty. We've actually learned right here in Morning at NTV that there are individuals who had the money to actually put in place these standard operating procedures. And you had people who had no option. They were wallowing in poverty. How many could buy soap? How many could afford water? How many could put in place all these facilities that are needed to be able to abide by the standard operating procedures? The issue of social inequalities, of course, takes center stage. Poverty and money. During this COVID-19 pandemic, government did little to help people adhere by the SOPs. Would you agree?
Yes, I think so. Poverty is very central in this issue because most of our people live by the day, and by the SOPs, some of them have been significantly impacted. A case in point are the teachers. The teachers have suffered financial difficulties. Many have pay and some laid off and humiliated. It is very unfortunate, but it's, I think, a problem world over. Many have had to lose jobs and so forth. But of course, we need to see how we can mitigate that situation and support those who have no savings, those who are completely washed down in terms of jobs as a result of COVID-19 restrictions. But it's a big problem, and it's difficult to find a complete solution to.
So if government doesn't help these individuals alleviate the economic challenges brought about by COVID-19, could it be wise to surmise or finalize and say that COVID-19 might persist and people might be adamant to adhere to the standard operating procedures simply because they do not have the money to enforce the SOPs?
Yes, definitely. I think the question of poverty coming in is very crucial. That also seems to propel the frustration and resistance to the SOPs, because somebody asks that if I social distance, if I stay at home, then how will I earn a living? And that can trigger anger and resistance, definitely.
So, Mr. Nyende, if you could advise the Ministry of Health and by extension the government of Uganda, what would you tell them in respect to observing of SOPs?
I think that they need to continue using a persuasive approach. They need to allow unfolding to take place, schools to be reopened, but in a staggered fashion, support people who are completely washed down by the regulations, the new regulations, and just continue to provide education to the general public.
Of course, you say they should continue with a persuasive language, but they've not been using a persuasive language. You also said they should continue finding some way of funding individuals to ensure that they adhere to the SOPs. They've not done that. So in the absence of all these factors, and if government continues not to actually listen to your advice and so forth, do you think there shall be a problem when it comes to adhering to these SOPs and then an increase or uptick in COVID-19 infections?
Definitely. If we are not taking appropriate action and the population is continuing to feel a sense of frustration, the problem is likely to be escalated. As mentioned, resistance increases and people will spread the infection the more.
Final word, Mr. Paul Nyende, to the viewer who's watching and skeptical about the existence of COVID-19 within Uganda. Final word, right there.
I think it's important to maintain SOPs. It's for our own good, and the regulations are there for our well-being.
All right, please do not tire from implementing the standard operating procedures. They're one of the weapons that we have in our arsenal to be able to ward off the contraction and the spread of the COVID-19 disease, because It's still rearing its very ugly head. 40,357 cases have been registered right here in Uganda. And out of those, you have some 24,300 plus active cases. And some good news, yes, 14,600 people have recovered. But unluckily, 334 people have succumbed to the novel coronavirus disease. On the international scene, 114 million plus cases have been registered on the global stage. And if you look at the US, they're taking the biggest chunk of those cases with 28.8 million plus cases of COVID-19, and over 2.5 million plus people have succumbed to the novel COVID-19 disease. So that's why it's important for you to wear a face mask before you leave your house. Whenever you go to a hot concentration, ensure that 2 to 3 meter distance from the next person. Even though you're wearing a face mask, there's a 20% window that you'll be infected even though you're wearing a face mask. That's why we tell you to leave that space between yourself and the next person. My name is Romeo Basiku. Of course, you're still watching Morning at NTV. Let's take another breather.